Um, well, Rosie, do you have a question for Supervisor?
I do, Supervisor. What would you say to members of our community who have Kaiser insurance, who have their private insurance? Why should they care about the fiscal health of a county hospital? And there are community members who feel that way.
Sure. So there are a lot of reasons. We can look at people with private commercial insurance, Kaiser, even Medicare. What happens in hospitals is that they charge insurers for the price of caring for patients. When um, when the Medicaid dollars are reduced, which means less money will be reimbursed, hospitals are going to look for other sources to build up that revenue because they are still required, even Kaiser, Stanford, Good Sam, they are required to see any patient that walks into an emergency room. And a patient who has received Medicaid, who no longer has it, no longer can go to a doctor or receive primary care without that insurance, but they can always go to an emergency room. So we are going to see more and more patients going to emergency rooms, which number one will create longer waits, not only at the public hospitals, but at the private. And we are going to see rate increases at the private hospitals to compensate for the lost dollars. And who is going to pay those increased rates? The private insurance companies will turn to their customers and charge them more money so that they can pay the higher rates to the hospitals. Everybody passes on the dollars. Another challenge, and why people should care, is that access may be diminished. If enough patients lose their health care and a hospital census is decreasing, they may decide to close certain services, just as Regional Medical Center did, if those services are not drawing in enough money. So as services close at private hospitals, the access to care diminishes. The only reason that our county owns 4 hospitals is because the private commercial healthcare industry did not believe that it was profitable for them to continue to operate. We had no desire or vision of becoming a major healthcare provider. But if you'll recall, in 2018, I believe it was a hedge fund, Verity, that owned O'Connor and St. Louis and some other hospitals, went into bankruptcy. Our county was the only entity that made a bid to buy O'Connor and St. Louis. We closed that sale in, I believe, April of 2019. Imagine for a moment that those hospitals did not exist 13 months later when the pandemic began in earnest. We bought Regional Medical Center because our 3 hospitals at the time, we had 3, were nearly at capacity. We were starting to see longer waits, and Regional Medical Center was closing department after department, first labor and delivery, and then comprehensive stroke services, and then the highest levels of trauma and heart attack services. Those patients were coming to our hospitals, to the public hospitals, and straining our systems. So purchasing St. Louis Hospital, Regional Medical Center, essentially became a cost savings measure because we're going to be treating those patients anyway. And we are not interested in making a profit. We are interested in providing health care. It's also important to point out that when we bought those 3 hospitals, we did not come to the voters for additional funding. That is really significant. Our business model could sustain the addition of 3 new hospitals without additional funding. We did not overinvest in the healthcare system. We did what we could manage. What has fundamentally changed is the sweeping changes to Medicaid that are so much larger than anyone could have anticipated. That has been the change in the financial situation, and that is what is causing us to need to go to the voters now.